Rita Johnson-Mills is our first guest today, and she is the CEO of UnitedHealthcare Community Plan of Tennessee. Good to see you, Rita.
Thank you.
I know this plan covers a lot of Tennesseans. Tell us more about how the plan really works.
Happy to do so. We are a statewide managed care plan under contract with the state of Tennessee Bureau of TennCare, and we're one of 3 statewide managed care organizations that arrange for the provision of health care services to the low-income eligibles in the state of Tennessee. We currently cover a little over 500,000 lives here in the state, and travel all over making sure that those that need health care are receiving health care the right time, in the right setting, and in the most cost-effective and efficient manner.
Which really leads us into my next question about the new program you have, Fresh Savings, which I like the title of that. Who does it serve, and what is your specific goal with Fresh Savings?
So Fresh Savings, just the name of it, just makes you breathe easier. It's like it smells good, so it's got to taste good. It's anything that's fresh. And the Fresh Savings program is a joint initiative, first with the AARP Foundation, who applied for a grant from the USDA, the Department of Agriculture, and they received a grant, and they needed a partner to help cover the portion of the program that the grant didn't cover. The Fresh Savings Initiative's primary focus is on seniors first, hence the AARP Foundation involvement. But it also focuses on everyone in that household, but with seniors as the #1 focus. So the states of Mississippi and Tennessee are the 2 states that are participating in the Fresh Savings Initiative.
Now, I know that the program involves farmers markets around Nashville. What part do they play in this program?
So not only is it farmers markets, but it's also Kroger stores. This program kicked off, it'll be a year, in this past October in the Memphis area, and now this past month we did a kickoff here in Nashville at the farmers market. And basically in the Kroger stores, for every $20 that a recipient or a SNAP recipient spends on fresh fruit and vegetables, they will get a coupon for $20 of free fresh fruit and vegetables.
Right.
And the farmers markets, for every $10 that they spend, they get $10 worth of free tokens. So the key is a SNAP recipient, and that will trigger the coupon or the tokens in the farmers markets.
So the people would automatically know that they qualify for this. And it sounds like it's pretty easy to use then, user-friendly.
It's very easy to use. We've already, in this short period of time, have had, coupon rate redemptions are pretty low nationally, like between 5 to 10%. We're right in between that 10 and 15% redemption rate at our Kroger stores so far. And the goal is to expand the program statewide. Right now, we kicked off in West Tennessee, and now we're in Middle Tennessee.
Why did UnitedHealthcare decide to get involved with this kind of program? I've read that there is an issue with hunger among our elderly population, so I assume that's a big part of this.
It is, and in the state of Tennessee, most people don't realize that Tennessee ranks 47th out of 50th for food insecurity amongst seniors. That's 47 out of 50
That's really
states.
Sad.
Our seniors are not having access to healthy, nutritious foods on an ongoing basis.
Why is that?
No
simple answer, probably.
There really isn't. I think a lot of it is environmental. It's an issue of if they live alone. It's an issue of really, I think in many instances, I think about my own mom who turns 87 this month. I know for a fact she forgets to eat because she doesn't feel hungry. And when she's, eating is a social event.
It really is.
And so if you live alone as a senior, you don't really think about eating when you're by yourself. because there's no one to socialize with. And in my situation, when we go home, my mom eats 3 squares and she eats everything you put in front of her, but not when she's alone.
And hunger obviously can lead to other health problems for our seniors. Let's talk about that for a second.
Yes, in addition to being 47th in food insecurity in seniors, Tennessee ranks 46 out of 50 states from a diabetes perspective. And the majority of those diabetics are our seniors. And many of them don't even realize it, which is also another reason that this is so important to United.
It can also lead to depression.
Depression, isolation. I mean, when you don't eat healthy, the lifelong impacts are it's crucial. You can't put a number on it because there are so many seniors out there that have no one visiting them, no one checking in to make sure that they are eating, no one even asking, well, what did you eat today? And I know when I ask my mom that, I don't remember.
Oh,
That's a telltale sign.
sure is. Well, let's go over again, Rita, the participating farmers markets again. I think we can put those up on the screen and go over those farmers markets again that are involved in the program. And I want to thank you again for coming in and sharing the information on Fresh Savings, because it's what a helpful thing to do for our seniors in the state of Tennessee. It's fabulous.
Well, thank you so much, and thank you
Thanks.
so much for shedding light on this critical health problem, as well as this great new program that has rolled out in the state of Tennessee.
Right. Thank you so much, Rita. And we'll
Thank
be
you.
right back right after this.